Hi, my name is Carlos Santamaria, Associate Editor with Devex. We're here with Jenny Johnston, Executive Director of the Coalition to Eradicate Viral Hepatitis in Asia Pacific, and we would like to know more from her on World Hepatitis Day, what the international development community needs to do better to fight the disease, especially in Asia Pacific.
Morning, Carlos. Thank you for having me. I think as a very first step, the development community can ensure that they themselves are fully informed about viral hepatitis because it's such a little and poorly understood disease. It's a silent disease with a long period where there are no symptoms. People, the majority of people do not know they've got it, especially in Asia Pacific, where for hepatitis B, the most frequent mode of transmission is mother to child. So this is an infected mother transferring at birth, so people don't know they've got this. And I guess the benefit of the development community informing themselves is that then this expands across the region in terms of awareness building. The other area that I think we would really like to see their activity is really, once they are informed, to start putting pressure on the global funding, the large global donors, to make them more aware of this disease and the need in Asia Pacific in particular.
Mm-hmm. So what exactly would you ask donors and I guess foundations and philanthropical organizations, what would you need from them to meet your goals?
I think resources are desperately needed to run public awareness education campaigns, to step up surveillance activity so that governments actually know the prevalence levels, they know where the prevalences are highest, and so that they can develop evidence-based policies that will support viral hepatitis. Resources are needed to enable diagnostics for screening, so people can be screened for the disease, particularly in high-risk groups, and also once diagnosed, for counselling. Often we have stories now of where some screening is carried out, people actually are told of their status, but there's no further support. So following on from the screening, for people who have tested positive, we obviously need medical treatment and follow-up, and where treatment is appropriate, for that treatment to be available. And that's, it's a huge process. It needs a lot of funding, but I think a coordinated approach is really the first step.
Mm-hmm. And how are you encouraging national governments to really start taking this disease seriously and spending more money on fighting it, etc.?
Well, in 2012, the World Health Organization released the Global Hepatitis Framework, which we see as a really valuable framework to assist governments in taking that first step. It focuses on 4 areas of activity, which they call axes. The first being raising awareness, mobilising resources, and promoting partnerships. And that's something that civil society is particularly good at doing, and the development community is very familiar with that process. The second is evidence-based policy, which I mentioned just now, to conduct policy research and conduct surveillance and measurements so that you actually know where to place limited resources. The next is prevention and transmission, and this brings in your sort of immunisation training of healthcare professionals, etc. And lastly, the screening, care and treatment. So they're the 4 components that, for governments, really guide governments. Some, I think probably most governments are doing some parts or various parts of this, but it really needs a coordinated approach with everybody working together, because there are so many different elements. It's a complex disease, and I think the WHO has a really leading role, particularly in Asia, where they've already had the experience of HIV and of SARS, they are very well placed to know what's needed. And I think those frameworks for us, we support, and that would be the very first step.
Mm-hmm. And why is Asia Pacific really the main battleground for this disease?
I think it's not really well understood. Firstly, of course, with the largest population in the world and high prevalence, the sheer numbers are one factor, but that's not just that alone. I think the fact that in Asia the most prevalent common transmission mode being mother to child means that disease progresses far more readily in the community than, say, in Africa. We know that it's more likely to be child to child. And I guess the significance of the mother to child mode of transmission is that research, I think probably 20 to 30 years ago, it was discovered that if in the first 5 years of life infection occurs, that has a far greater chance of developing through to a chronic disease. Whereas after that, say if you or I contract, say, hepatitis B, I'm talking about, we're most likely in 90% of cases to clear that. So it's really that critical stage of the first 5 years of life, and especially as an infant, that they have over 70 to 80% chance of developing chronic illness. So that's a different profile to, say, later infection, which is one of the, I think that with the population is why Asia is really the epicenter for viral hepatitis.
Mm-hmm. Finally, I would like to ask also, have there been any recent interesting innovations in the sector that should be on our radar and maybe could be scaled up to strengthen the fight against the disease?
I think firstly, in the last decade, we've seen some really valuable antiretrovirals for hepatitis B coming on board, so that if someone is diagnosed early enough before the disease has progressed too much and the liver damaged, antiretrovirals as a lifetime therapy can prevent cirrhosis and cancer. So that's one. It's, for hepatitis C, we've now seeing the very first direct antiretrovirals, direct acting antiretrovirals, DAAs, that really for the first time have between 90 and 100% chance of cure for hepatitis C. So while there's no vaccination for hepatitis C, these new drugs are very exciting, coming on board that will, in most cases, see, say, a 12-week program that can eradicate the disease of viral hepatitis C. So the big question there is cost, and they will be costly therapies. So in terms of scaling up, I think we need to be looking at the HIV experience and what has been learnt there to see how those, what mechanisms can be put in place. We have that experience now. We hope that it won't take 20 years before we can actually see those most in need getting access to those drugs.
Mm-hmm. I know you recently attended the Global AIDS conference in Melbourne. What insights did you learn there that, as you say, can be applied to your organization and its purpose?
Yeah, I think this was a very hot topic. The new paradigm of treatment that we'll probably see a broader section of the healthcare professional community being able to treat, for instance, for one thing, and also the access issue was raised often. WHO is very aware of this, and is working very closely with the civil society community and the HIV community. One welcome step we've seen occurring at WHO headquarters is that they have now brought the viral hepatitis global program in under the wing of HIV, and there's a lot of cross-fertilisation of ideas there. They're drawing upon the experience of those professionals who've worked in the HIV arena. So I think this is very welcome, and hopefully we can truncate that length of time before valuable therapies are reaching those who need it the most. Going back to your original question of what can the development community be doing, I think it comes back to that resource mobilisation of actually alerting the world, particularly for Asia Pacific, that for this is our disease, this is our pandemic that we really need to address. 3 times the number of people die from the effects of viral hepatitis as die from HIV, yet everybody is very aware of HIV. This is not a competition. HIV is a terrible disease, but if you're looking at numbers and looking at a really unaddressed need, I think for us it really is viral hepatitis.
Well, thank you very much for taking the time to speak with us.
Thank you very much, Carlos.